1. So this is technically a near-death/death experience, I guess. A hospital I worked at used the mechanical compressors. So instead of people doing chest compressions, we would strap this machine on and let it do the work. It was actually pretty effective. Got called to a code, patient was out, strapped the machine on, patient wakes up and starts yelling at us to stop, it hurts. Turn the machine off, patient goes down again. Turn the machine on, patient wakes up. We did this for what felt like forever. The patient, by the end, was crying and asking what was happening every time we started the machine. In the end, we were not able to save the patient. It still stands out as one of the most traumatic things I've seen/done in my 20+ years of working in the medical field, and that includes working in big city trauma centers. 2. This was many years ago when I was a nursing student and working part-time at a hospital. A patient had really severe throat cancer and one of the tumors eroded her carotid artery. Blood was, the only way to describe it, was just gushing out in a pulsing fountain. It took what seemed like hours, but somehow the doctors were able to close the hole long enough to get her into surgery. She lived a few more weeks afterwards. We were all just covered in blood. I went home in scrubs and just threw my entire uniform and shoes away. 3. I observed the level 1 trauma team work on a man who apparently had shot himself in the head, I believe with a shotgun. I did not get a good look at his head, but there was blood everywhere all over his body. Somehow he was still alive. The saddest part was when the paramedics found him, his dog was sitting on his lap trying to protect him. I had to leave the area and find the person I was supposed to shadow, so I have no idea if the guy made it or not.